Hello, future nurses. Welcome to our lesson on theories and principles of health ethics. Think of this topic as your personal moral compass. Okay? Every single time you make a decision for a patient, whether it's giving medicine, talking to them, or solving a problem, these ideas will guide you. No? Ethics will guide you to do the right thing. And without this compass, you might get lost or confused when hard situations happen. So today we're going to cover three main ways of thinking about what is right and wrong. Now we call these the theories. Also, we're going to cover the five core rules that you must follow every day. And these are what we call the principles. Actually, hindi lang five. There are also other principles that we're going to discuss, other related principles. And then we're also going to cover the patient's rights and Philippine laws that protect the patient's safety and welfare. And most importantly is how to solve difficult situations, how to navigate through the difficult situations. Um, and maybe some of these situations you haven't seen yet in your clinical rotation. Since you are still second year nursing students, and I know that you haven't had much exposure yet. So we will try to discuss everything simply with lots of examples. No? So you will understand exactly how to navigate these scenarios when you finally go to the hospital. All right? So what exactly are you going to learn from today's discussion? Let me break it down for you. By the time we finish the lesson, you won't just know the words or memorize definitions. You will actually know how to use them. Specifically, those ethical theories and those principles, ethical principles, how to apply them. And also, you will learn how to think like an ethical nurse, protecting your patient's rights, and how to make the right choice even when the situation is confusing or no one is watching. Okay. Um, Also, I hope that after the lesson, I hope that you can develop the beginning skills in moral reasoning. And I hope that this will also cultivate virtues in you, and values that are essential for nursing. So basically, this isn't just textbook stuff. This is exactly what you will use in the hospital, clinic, or community. And you will build the kind of character that makes patients trust you completely, because trust is your most important tool as a nurse. Okay? Now let's move to the discussion of ethical theories. Think of these theories like three different maps that all lead to doing good. No? But each theory used different directions or rules. First is the deontology, which is also called the duty-based ethics. It focuses on moral rules. And this one is actually strict. It is when the person says, I follow the rules because it is my duty. So in this theory, rules are rules and you follow them no matter what happens. Like for example, when you tell the truth, even if it gets you in trouble or hurt someone's feelings. So that is an example of deontology, because it is uh, you want to perform your duty, to tell the truth. That's the principle of veracity. Then the next is the teleological ethics. No? which is also called the consequence-based ethics. It is here where outcomes matter most. Okay, so this one looks at the result. It is when the person says, "I look at what happens in the end." So, and if the result is good, the action is right. For example, you choose the action that helps most people, even if the process is hard or strict. Okay? And the next is the virtue ethics. It is also called character-based ethics. No? It is about cultivating moral values, no moral virtues. So this is basically about you trying to be a good person. So if you are honest, kind, and brave, you will naturally do things. Like for example, you stay late to comfort a grieving family, not because a rule says so, no, but because you care. Simple as that. So um, so these three, no, are the three ways people decide what is right. So these are like what I've said earlier. They are like different maps, different ways of doing things, of deciding on what is right. Each has its own basis. Okay? And now let's dig deeper into deontology. This is one of the most famous theories, no, in ethics, created by a very smart philosopher named Immanuel Kant, or popularized, no, by Immanuel Kant. The big idea here is simple: do the right thing because it is the right thing to do. No, in this theory, the result does not matter. What matters is, did you follow the rule? Did you do your duty? Did you have good intentions? And Kant said there are two types of duties you must know. First is the perfect duty. These are absolute rules. There are no excuses. So you must do them every single time, no matter what. Like for example, telling the truth. No? You never lie, ever. Even if lying would make things easier or happier, you still tell the truth because it is your duty. Particularly in patient care, no? When you are taking care of a patient, you have to tell the truth. Then the second one is the imperfect duty. These are things that you should do, no? But you choose them. You choose when and how to do them. Like for example, helping people. Well, you cannot help everyone in the world every minute, no? But you do it when you can and when it is appropriate. And remember, not everyone is equal. You treat the rich, the poor, the educated, and the uneducated exactly the same way. No one is better than anyone else. All right? Let's put deontology into a real situation. No, applying deontology in a real situation. Something you might actually see even as a student. So listen carefully because this is important. Imagine you are observing in the ward. You see Nurse Maria give a medicine to a patient, but you realize it's not the medicine written on the doctor's order. So obviously, it seems like it's a medication error. No, but thank goodness the patient is totally fine. There is no bad reaction, no pain, nothing. The patient doesn't even know it happened. Nurse Maria comes to you and whispers, "Please, please don't report this. I have kids to feed. I'll lose my job." And the patient is okay anyway, right? So, Nurse Maria is even asking you, just keep it as a secret between us. Now, the dilemma is you are stuck. If you keep quiet, you are being kind to your colleague. But if you report it, you are following the rules and telling the truth. So what are you going to do? What deontology says is you must report it. Why? Because deontology says rules are rules, no exceptions. You have a perfect duty to be honest and keep patients safe. No? And Kant had a famous rule: only follow a rule if you would want every single person in the whole world to follow it too. If you hide the mistake, you are saying it's okay to hide mistakes. But if everyone hid mistakes, hospitals would be dangerous and no one would trust nurses. If you report it, you are saying be honest and safe. That is the kind of rule we want everyone to follow. Now, for you as students, even if it feels hard or awkward, your duty to the patient, no, and the truth always comes first. That is how you become a true professional. Okay? Now, take 2 minutes of your time to think quietly. Would you report it? Okay? Kant's big main rule is called the categorical imperative. It has two simple parts that you will use all the time. First is the universal law. No? Only do something if you want that rule to apply to everyone. So, for example, if you break promises, you are saying it's okay to break promises. But if everyone did that, no one would trust anyone anymore. So, breaking promises is wrong. Another is respecting people, no respect for persons. Never use people just to get what you want. For example, uh, don't rush a patient just so you can finish your work early. That is using them as a tool, not respecting them as a person. No? And remember the order. Perfect duties are always more important than imperfect duties. No? So, in simple terms, like for example, truth telling is always more important than being nice. Okay, think about it. If you have to choose between being nice and telling the truth, then definitely deontology says truth wins. All right? Now, let's flip to the opposite way of thinking, the teleological ethics, or simply teleology. This one is all about results. The rule here is an action is good if the result is good. So it doesn't matter so much what rule you followed or what you intended. What matters is what happened in the end. No, what is the outcome? And there are a few types, no, uh, under teleological theories, no, or ethics. First is egoism. The rule is in egoism, do what is best for me. So, and of course, egoism, we rarely use it in nursing. Another one is utilitarianism. Do what is best for the most people. And this is the one we use most in healthcare. Okay. The next one is eudaimonism. Do what brings happiness and well-being. Now, for example, you give a medicine that has a small risk of side effects, but it will cure a serious disease. Teleology says it's okay because the good result is way bigger, no, than the small risk. Okay, see the difference between deontology and teleology? No? So, deontology says follow the rule no matter what. Teleology says look at the result. Okay? The most famous and important type of teleology is utilitarianism, popularized by Bentham and Mill. And the rule is simple: choose the action that creates the most good or happiness for the largest number of people. So you basically weigh the good versus the bad. You calculate How strong is the benefit? How long will it last? How sure are we it will work? How many people will it help? No? One specific example is, imagine there is a big emergency like a fire, no, or a pandemic. There are only 5 beds available, no, in the hospital, but 10 people need them. Utilitarianism says, give the beds to the people who have the highest chance of living and recovering. Why? Because this way you save the most lives possible. You are not being mean. You are choosing the action that helps the most people. And this is exactly how we handle disasters or shortages in healthcare. We save the most lives possible. Do you understand? Here are 3 other ways people think about ethics. You will hear these in discussion, so let's understand them simply. One is subjective relativism. Um, it is when someone says something is right, but if I think it is right. Okay, so something is right if that person think it is right. But what is the problem? Everyone has their own truth. So if everyone has their own truth, then there are no standard rules. And this doesn't work in healthcare because we need rules, no, to keep patients safe. Another one is cultural relativism. This when a person says something is right if my culture says so. The good point is that cultural relativism respect differences. We don't judge other people's traditions. But the bad point is it is hard when cultures disagree. Like for example, one culture might say tell the patient, another says don't tell. So who is right now? No? So whose voice matter? Another one is the divine command theory. This is when someone says something is right because God or scripture says so. No? So uh, it is a strong moral guide, but different people have different beliefs. So we cannot really use this alone, no, as a hospital rule. All right? Now let's talk about virtue ethics. This is actually one of my favorites, no, and probably the most important for nurses. This one doesn't ask what rule should I follow or what result will I get. It asks what kind of person should I be. So the big idea is if you are a good person, you will naturally do good things. No, it is popularized, no, by ancient philosophers like Plato and Aristotle, and also from Eastern ideas like Buddhism and Confucianism. So one example is a nurse stays late to comfort a grieving family. And why the nurse is doing this? Not because a rule says so, not because she gets a reward, but because she is compassionate. That is who she is. And as a nurse, your character is more important than any rule book. If you are honest, kind, brave, and wise, you will make the right choice almost every time. Now let's talk about virtue ethics in nursing. Unlike rules or laws, virtue ethics focus on who you are as a nurse, your character, your values, and the kind of person you are. It asks what would a good nurse will do in a particular situation rather than just asking what does the rule say. So uh, what is the origin of virtue ethics? Like what I've said earlier, no, this is actually, it began with Aristotle. No, this is actually the oldest ethical theory in history. Now, it began with Aristotle, the Greek philosopher, around 350 BC. No, and in his book, the Nicomachean Ethics, he taught that ethics is not about following rules, but about developing a good character, becoming a person of excellence. And he said, we become just by doing uh, good acts, no? Temperate by doing temperate acts, and brave by doing brave acts. Later in nursing, this was adopted because our profession is deeply personal. The quality of care depends entirely on the character of the nurse. The framework that you see in virtue ethics was actually organized by Viats and Gildry Grimes in 2019, the authors of the textbook on ethics, no, who combined classical philosophy with modern nursing standards and cultural values. Now, we break down virtue ethics in nursing into four main categories. First is the professional virtues. These are the values written in our code of ethics and professional standards. This includes purity and holiness. Now, in our profession, this means keeping our practice clean, honest, and free from corruption or improper acts. We maintain high moral standards, no, that reflect well on our profession and our community. Another one is integrity and safety. We protect the safety, dignity, and rights of the patient at all times. No, we do not cut corners, we do not hide mistakes, and we always act with honesty and accountability. For example, if you make a small error in medication, you report it immediately. That is integrity. The next is the religious virtues. Okay, since the Philippines is deeply religious, these shape almost every decision we make. No, these religious virtues, and majority of Filipinos are Roman Catholic. So let's talk about the Roman Catholic virtues, the seven virtues. Okay, and these uh, come from Saint Thomas Aquinas, who combined Aristotle's philosophy with Christian teachings, no, in the 13th century. He identified these as the key moral virtues that guide a good life. All right, and these Catholic virtues are prudence, which means thinking carefully before acting or choosing the right way. Another one is justice, which is giving everyone what is due to them or being fair. The next one is temperance, which is all about self-control, no, not overdoing or abusing anything. And then the fourth one is the fortitude, which is the courage to do what is right, even when it is hard. Next is faith, which is trust in God and in the good of our work. Six is hope, believing in good outcomes, even in difficult times. Then, last but not the least, of course, is love or charity, which is the greatest virtue. No, identified as the greatest virtue, which it is selfless care for others, no matter who they are. So, for example, a patient who is rude or difficult, you still care for them, no, with love and patience, because that is your virtue. Then the next category is the secular virtues. These are universal values not tied to any religion, but essential to all ethical practice. They are also based on Aristotle's original list of cardinal virtues. And this includes justice, courage, temperance, wisdom. No? We've already talked about justice, courage, and temperance a while ago, no, in the seven virtues. Um, Now let's talk about wisdom. Wisdom is knowing what is right, no, and how to apply it. Okay? Yun. Other religious virtues is another category. We also respect and learn from other beliefs. No, because our patients come from different backgrounds. So these are drawn from the ethical teachings of each faith tradition. First is yung sa Islamic community, no? Virtues on commitment, gratitude, generosity, which is taught, no, particularly in the book of Quran, no, and Islamic ethics. For Hindu naman, virtues on care, attention, humility, no, from Dharma, which basically highlights duty and righteousness. And another is Confucianism. No, in Confucianism, virtues on humaneness, compassion, filial piety are highlighted. No, these are from the teachings of Confucius in 500 BC, who taught that respect, family, and kindness are the foundation of society. So it is important, no, that you do not need to share their religion, but you must also respect and practice these values in your patient care. And since we're in the Philippines, of course, we cannot ignore, no, our own cultural values. Uh, this is most important part of us. So these values are not just from books. They come from hundreds of years of Filipino culture, history, and tradition. And the first one is family is everything. No, our how we value our family. In Filipino culture, decisions are rarely made alone. The whole family decides together. So we respect the family unit above all. Right? Uh, Next one is pagmamalasakit. This is a unique Filipino value. It means deep concern, care, and empathy. No, that goes beyond duty. It is basically caring for the patients as if they were your own family. And then last is hiya or dignity and respect. The value of hiya, no? We never embarrass or shame a patient. We protect their dignity at all times. We speak gently. We act politely. Okay? And we honor their status and feelings. Okay? So, in virtue ethics, uh, good character leads to good actions, and good actions will lead to, of course, good patient care. And when you have these virtues inside you, you will naturally make the right decisions, even when there is no rule book. Okay? So that is virtue ethics in nursing. Now, let's be more specific, no? Let's talk about core values of professional nurses. There, it is said that there are 7 praiseworthy character traits that define a true professional nurse. And this list was developed by Biach and Gildry Grimes, no, in 2019 based on the International Council of Nurses, no, Code of Ethics, and decades of nursing experience. So these are not just words, no, these are the values that nurses must live, no, by every single day. So let's go through each one deeply with examples. First is fidelity. Fidelity is when one is faithful to agreements, faithful to responsibilities and commitments with integrity. Its origin is it comes from the Latin word fid, fidelitas, meaning faithfulness and loyalty. Now, in nursing, this was formalized as a core value by Florence Nightingale herself, no, in the 1800s, when she said, "Nursing is a commitment, not just a job." Okay, so this means you have to keep your promises. If you say you will come back, you come back. If you're assigned to a patient, you stay responsible. You are loyal to your profession, your patients, and your team. No, example, you promised a patient you would help them call their family. Even if you get busy, you do not forget. That is fidelity, right? Then second is honesty. Honesty is being fair, just, free of deceit and cheating. It is rooted in the ancient virtue of veritas, no, or truth. In nursing ethics, this became a requirement after the 1970s, no, when the patients' rights movements demanded full, truthful information. So nurses should not lie. They should not hide information or fake reports. Nurses must tell the truth gently but clearly. Honesty builds trust, and without trust, there is no care. So, for example, if you do not know the answer, you just say, I do not know, but what I will find out for you. So, you do not make up anything. Okay? Next is humility. It's being modest, unpretentious, simple, and submissive. Okay? It is from religious and philosophical teachings and is deeply emphasized also by Florence Nightingale, who described nursing as a calling of service, not a status. It is also the most important value in Filipino culture. Okay? And actually, humility is very Filipino. You do not act like you are better than anyone. You're not the patient, not the family, not the doctors. You know that you are a servant and a helper. You are willing to learn, willing to listen, and willing to admit when you are wrong. So, for example, even if you are a senior nurse, you listen to the new nurse or the patient's family because everyone has something to teach. All right? Then next is respect. Respect basically is about differential esteem for patients, team, and community. It is based on the philosophy of Immanuel Kant, no, in the 1700s, who taught uh, to treat every person as an end in themselves, never only as a means to an end. And this means every human being has dignity no matter what. Okay? You treat everyone with honor, regardless of age, status, wealth, religion, or illness. You respect their body, their beliefs, their choices, and their privacy. For example, you always knock before entering. You cover their body, the patient's body. Uh, you drape properly. You speak politely, even if they are confused or angry. Okay, so that is respect. Then the next one is the next core value of a professional nurse is compassion, which is basically means to serve others selflessly with genuine care. No? It is from the Latin term compati, no, or which means to suffer with, and this is the heart of nursing. Florence Nightingale called this as the essential spirit of nursing. It is what separates nursing from any technical work. Okay, for example, a patient is crying. You do not just say, it's okay. Instead, you sit with them, you hold their hand, and let them know you are there. Now, that is a demonstration of compassion. Then, number six is prudence. No, another core value of a professional nurse. Prudence means being cautious. No, uh, a person is prudent when he has foresight and discretion. So the first and most important virtue that is discussed by Aristotle is actually cardinal virtue discussed by Aristotle is actually prudence. No, it means practical wisdom. It's knowing how to act well in specific situations. So a nurse must think before she acts. Okay, you have to think about the consequences. You do not rush. You use good judgment, and that is being prudent. For example, before giving a medicine, you check 3 times. You also try to think, what if I make a mistake? What will happen? No, when you are doing this, that is actually practicing prudence. Okay. Then last is courage. Courage disregard fear. No, in acting out convictions. Um, Courage finds strength despite physical and emotional exhaustion. It is also another virtue discussed by Aristotle, no, and famously demonstrated also by Florence Nightingale during the Crimean War when she risked her life to care for soldiers. So, courage is not being afraid, it is doing the right thing even when you are afraid. So, you stand up for patients, even against doctors, administrators, or families if needed. You keep going even when you are tired or sad. That is also courage. Um, for example, you see a patient being treated unfairly. You speak up even if it is uncomfortable. So that is courage. Okay. Now, when you cultivate these seven virtues or values, no, you will make decisions based on social values and needs, not just rules. You become a nurse who is competent, compassionate, and respected. Okay? Next is virtue-based nursing model. This model explains how you grow into an ethical, excellent nurse. It was actually developed no, in 2019 by Biach and Gildry Grimes no, by combining Aristotle's virtue theory with modern nursing professional development. So it shows that virtues are not born, they are developed. You build them through practice. There are four key parts, no, each with its own philosophical origin. First is the insight or Sophia, wisdom to think well about the nature of the world. Involves careful deliberation of universal truths. Its origin no, is a Greek word meaning uh, the Greek word Sophia, no, meaning divine or deep wisdom. Aristotle distinguished this from practical knowledge. It is Sophia is the ability to understand the deeper meaning of life, health, and suffering. So insight is basically deep understanding. You do not just know how to do things. You also understand why they matter. You will reflect on life, health, suffering, and what it means to be human. You ask what is good, what is true, what is right. For example, you understand that pain is not just a symptom, it is a human experience. That insight changes how you take care of the patient. Okay? The second is practical wisdom or the phronesis, which is the capability to consider the mode of action to enhance quality of life. It involves using insight to direct actions. Phronesis is Aristotle's term for practical wisdom. The most important virtue for ethics no, is practical wisdom, according to Aristotle. It means knowing how to apply general rules to specific, unique situations. And this is wisdom in action. You take what you know and you apply it to the real situation. You know the rule, but you also know how to adapt it with kindness and judgment. Okay, for example, you know the rule that says no food before surgery, but you use wisdom to explain gently no, to the patient, not it, especially for anxious patient. So we explain it gently, not strictly. Okay. The third one is choice or prohairesis, which is morality achieved through choice, facilitated by insight, practical wisdom, and evenness of emotional states. Prohairesis is Aristotle's word for moral choice. He said that virtue is a state of character concerned with choice. Ethics is not about what happens to you. It is about what you choose. Okay? And ethics is all about choice. Every day, every moment, you choose, di ba? Will I be kind? Will I be honest? Will I respect? And good choices come from a good character and good thinking. Okay? It is important even when tired, stressed, or busy, you still choose the right thing. Okay? So yun. So that is choice. Then the fourth one is goal or the telos or the ultimate purpose, which pertains to personal and professional excellence, characterized by active happiness and well-being. No, consistent with enlightening awareness of moral nature of work. Telos means purpose or end goal. No, a central idea in Aristotle's philosophy. So, uh, it asserts that everything has a purpose. The purpose of a human being is to live a good, virtuous life. Okay? So, that is according to Aristotle. Now, so what is your goal? It is not just to finish your shift, no, as a nurse or even as a student nurse. It is excellence, dapat ang goal. It is becoming the best nurse you can be and finding meaning and joy in your work, no? Even in your studies right now as a student, no? So, it's becoming the best student nurse you can be and finding meaning and joy in your work as a student nurse. You know that your work is a moral work. It is something good. It is something noble and it actually changes lives, right? So nurses cultivate these virtues through habitual practice, enabling growth in character and professional excellence. And this is the secret that virtues are built by doing them over and over again. Repetition. Every time you are honest, every time you are kind, every time you are brave, you make your character stronger. You're building muscles, kumbaga. No, over time, being good becomes natural, easy, and automatic because you got used to it already. Okay?